Dear colleagues, I would like to present my 3 months progress report. My PhD topic is cervical diseases and their connection with clinical and health factors. So I am a resident at the Department of Obstetrics and Gynecology. My supervisor is Associate Professor Dr. Melzer. My SMS is Brigitte Deutsch. My vision is that in 5 years' time, the Hungarian cervical cancer screening will be based on primary HPV detecting above the 30 years age group. And my mission is to change the Hungarian guidelines on cervical cancer treating and screening and treating. So I have these 2 specific goals. The first is the effect of trichomonas vaginalis infection on cervical carcinogenesis. The second is the effect of topical imiquimod treatment on reducing cervical intraepithelial neoplasia. So about my first topic, to give you some background. The lifetime prevalence of HPV infection among women is around 80%, and it's a necessary but not sufficient cause for cervical cancer. Other risk factors are needed, which some of them are well known, and some of them are we learning still. Trichomonas vaginalis infection causes inflammation and decreases protective barriers of the vagina and the cervix. Inflammation of the cervix might cause persistent HPV infection and progress in cervical carcinogenesis. And also, trichomonas vaginalis infection can carry HPV just like as a Trojan horse. Our aim is to assess the effect of trichomonas vaginalis on the increased risk of cervical carcinogenesis. Our question is that does trichomonas vaginalis infection increases the risk of cervical carcinogenesis? Our population are sexually active women. We intend to find trichomonas vaginalis infection, and we would like to assess the outcome of HPV infections, cytology, and histology. Our other population are HPV infected women, and we would like to assess the same as above. And our hypothesis that trichomonas vaginalis infection increases the risk of cervical carcinogenesis. And there is a clinical implication that there is an association between trichomonas vaginalis infection and the risk of cervical carcinogenesis. So we run a systematic search with this search key in this internet databases. Currently, we are in the phase of data extraction. We are very eager to find our interpretations. So my second topic is the effect of topical imiquimod treatment on reducing cervical neoplasia. In case of precancerous state of the cervix, guidelines only recommend surgical treatment. Although around 90% of cases or more are caused by HPV infections, and the surgery doesn't, although it's necessary, but doesn't treat the infection itself. And topical imiquimod is an immune response modifier and approved for genital warts, basal cell cancer, and actinic keratosis. And in one study, imiquimod fastened HPV clearance by 60%. So our aim is to assess the effect and safety of topical imiquimod therapy on reducing cervical intraepithelial neoplasia. Our clinical question is that what is the response rate to topical imiquimod therapy in cervical intraepithelial neoplasia? And we will seek the response rate of women who were treated with topical imiquimod, women who have cervical intraepithelial neoplasia, and in a different form of question, we would also compare imiquimod treatment to a standard care or a comparator. And our hypothesis is that topical imiquimod treatment is effective and safe on reducing cervical intraepithelial neoplasia. There is a clinical implication that there is a good response rate of SIN patients to imiquimod therapy. We did our preliminary search and we are registering our Prospero just right now, and we want to submit these 2 papers in 2022. And thank you for your kind attention. And my quote is: if you think you are too small to make a difference, try sleeping with a mosquito. Thank you very much.
Well done, beautiful presentation, very exciting project, very small point. I didn't know that you are a gynecologist, so I was wondering with your opening slide if you are going to talk about your expertise in the neck or the ladies' diseases. Your first slide when you say, I want to be cervical someone, and I was wondering if you are a neck doctor or a ladies' doctor, basically. That's just a small point. With your first project, the PICO.
Yes.
There are the outcomes which are, I want to understand that slide. Can we go back to that slide? There's this thing that you say the outcomes are cytology and histology, and I've got a feeling that those are the methods which you use to measure your outcomes. Those are not the actual outcomes, are they?
Yes, that's
what are the outcomes?
Yeah, that's more precise what you say. These are the methods.
Is it dysplasia and cancer? The outcome, or
the outcome is dysplasia itself. Yes.
Okay.
Yes,
thank you.
and also the very important association is HPV infection itself. So we are talking about before the development of dysplasia.
Okay, good. Thank you. That was just my. Thank you very much for clarifying that.
Thank you. My question is for your second topic. That this imiquimod is already used for any kind of treatment right now in practice?
Yes, thank you for your question. Currently in the gynecological area, the American College of Obstetrics and Gynecology recommends to use in vulvar intraepithelial neoplasia by next to surgery, of course. So it's an alternative. So it's already an alternative treatment in vulvar dysplasias.
Hi, it was a wonderful presentation with your second project. Does it make any sense to exclude or include or exclude those patients who has given HPV vaccination before or not?
Yeah, that's a good question. I think there is no reason for excluding patients, women who were prior immunized by HPV vaccines, because the 2 things are different. You know, if you have an infection, you need to treat it. If the vaccination didn't stop the infection, so there is always treating, I think.